Health Scrutiny. So apologies for absence.
Chair and
Minutes of the meeting, pages 1 to 10. Anybody got anything to say on the minutes? Incorrect, correct, or wants further action?
move acceptance, Chair.
Done. Disclosure of members' interests, anybody? Nope. Health and Wellbeing Board, this is for information, but there is something on here, the note to 19, that has gone through the Health and Wellbeing Board. Remember, it was farmed out to Harrogate?
Yeah.
And they've had a look at it. They haven't found anything untoward, because I think we had requested, because we hadn't heard for a while. So that's in there. So if anyone wants to have a look at that and bring anything up, or anyone wants to say anything about it or highlight anything, please do so now. And that's pages 11 to 30. We're quite happy that we found nothing in. Can't see anybody registering anything. So we'll go now straight to item 5, the report of the cabinet member for improving public health and well-being. Now, this is the basis of our meeting today. So I'm going to go straight to Councillor Veronica Jones, who will introduce it. Now we go to Jill O'Neill and then Luke Robertson. Oh, sure, sorry. My right.
Chair. You'd be pleased to know I'm not going to say a great deal on this one. It is within my portfolio, but in actual fact, where most reports that come to you are from the cabinet member, this is the Director of Public Health annual report. It's an independent report that the Director of Public Health has to do each year, though I'm sure it's done very willingly. This is where we are on the particular topic. You've had them before, and they're always very interesting. Always a good read on where we are. So this is where we are on ageing well in Northumberland. So I'm going to go straight to Jill to tell you more about what it is.
Thanks, Veronica. Afternoon, everyone. I'm really pleased to be bringing to you today my first Director of Public Health report for Northumberland. I'm not going to steal the thunder of Luke, who's been the lead author for me this year as Acting Consultant for Public Health. And you'll note at the end of the report the number of acknowledgements and thank yous for the contributors of this report. It has absolutely been a multidisciplinary development piece. So adult social care very much in the thick of it, voluntary sector in the thick of it, NHS as well. So what I would like to highlight before I hand over to Luke, who's going to talk you through a formal presentation before opening up for comments. Required to produce one. It's always in the gift of the DPH as to what topic to choose. It's a commentary piece. It's like a state of the nation. So you'll note that there isn't a specific action plan at the end of it. It's about highlighting to you what is good in Northumberland and where we might want to go further, and where possible building these things into business as usual practice. So this very much aligns with the mantra and the emphasis of a strength-based approach in Northumberland, which is our way of tackling inequalities by looking at the strengths and the assets. And it very much aligns with the refreshed joint health and wellbeing strategy that you've also had come through to yourselves. I didn't focus on ill health, so you won't see a specific section in there around dementia or Alzheimer's or cardiovascular disease. This is about how we say it is possible to age well in Northumberland and have good functioning in Northumberland. Because we've got an ageing population, and also to draw out the many strengths and assets of our population. So that was the reasons and rationale for focusing on ageing well in Northumberland, and clearly the devil's in the detail, which I will hand over to Luke for before we then open up for any questions or comments that you may have. In addition to here, we're also presenting it to Health and Wellbeing Board. We're going to be sharing it across all of elected members as well electronically, and if there is any other particular forum you think it would be of relevance to have a more detailed discussion and presentation, then we'll be very happy to undertake that as a task. So I'll hand over to you, Luke.
Thank you very much.
Right, floor is yours. We have PowerPoint. Those, I'm sure it's 10 minutes.
between 10 and 15. Thanks so much, Chairman. Thank you, Councillor Jones, for the introduction. So I'm sure you'll agree that if we've got one thing in common in this room, is that we're all ageing. And it's one of the few things we can be certain of in our lives. I'm reminded about this every time I go to the hairdressers because my hair is slightly grey each time. And I'm like, oh, it looks slightly different. Oh, it's just a few more grey hairs. So what does it really mean to age well? What are the things that influence our experience of ageing well? And what can we do to support individuals and the population at large to age well in Northumberland? And as we've said today, we're really delighted to present the Director of Public Health report. We're really pleased with how this has turned out. As Jill said, I led on the development of the report, but it drew in a lot of other people into the production of it. So people within other areas of the council, some of our partners in other sectors that we work with. So it's very much a joint effort, and I think that really reflects the fact that ageing well is something that needs to be tackled by everyone. There's not one organisation or agency or part of the council that's going to be able to tackle that this issue alone. So I will move on to the first slide, which is not moving. There we go. So some of this has already been said by Jill and by Veronica, but the Director of Public Health report is a statutory duty, so every local authority has to produce one every year. And it's really the opportunity for the Director of Public Health to highlight an issue that they feel is particularly important to highlight at this time and particularly poignant. So we have to publish this report, and it's a really good opportunity. And as Jill said, selecting the theme of ageing well has been really thought about, and it's really something we want to highlight. And the next slide goes into some of the reasons for that, why it's important and why we want to highlight it at this time. So this first graph here shows the proportion of people who are age 55 plus in different local authority areas across the North East. And the orange bar there you can see is Northumberland. You can see that's a lot higher than other areas. So our starting point really is that we have an older population than most other areas in the North East. So ageing well is particularly important to us. And the next 10 years, we're likely to see this is likely to get more. So we're likely to see an even older population in 10 years' time. This graph shows the projected population size of different age groups over the next 15 years. And that green line is 65 plus age group. And we can see that that's rising quite steeply over the next 10 years. And then it begins to flatten off, and the younger age groups are generally reducing slightly and then flattening off. So this just demonstrates we're likely to see an even older population coming up. And so that's why now is really a key time to flag and highlight this issue and think about how we can support ageing well, because there'll be many more older people in our area. The next slide looks at inequalities in Northumberland, and there's a huge variation in people's experience of ageing, both in individuals and in communities. So this graph, basically two bar charts. The top one is the least deprived communities in our area within our local authority, and the bottom bar is the most deprived areas. And the bars represent life expectancy. So we can see that in the most deprived areas, people live much shorter lives. So the life expectancy in that group is 72-year-old, whereas it's over 90 in the least deprived areas. That's an 18-year difference in life expectancy, which I'm sure you agree is a really stark difference. So it's in the older ages that inequalities become particularly visible in terms of health and well-being in people's lives. The yellow part, or the kind of mustard colour part of the graph, is something called healthy life expectancy. And this is the age people live to in a state of good health. So before they've got long-term conditions or disabilities. So we can see that actually there's a big inequality there as well. So people in the most deprived areas get to just over 50 years old in good health, whereas people in the least deprived areas get to almost 75. And as you can imagine, that really impacts strongly on people's working life. So it's much more difficult to continue working. That's very much the same picture with females. So with this report, we've really tried to structure it around functions that support healthy aging. And as Jill said, traditionally people have looked at aging from maybe quite a negative lens of deficit, disease, and different things people have. But we really wanted to frame this report around 5 functions that support health, support wellbeing. So we've got meeting basic needs, being mobile, contributing to society, building and maintaining relationships, and learning, growing, and making decisions. So the rest of the report really structures around these things. And the idea of this is a really holistic view of looking at aging well, rather than it being that kind of disease-focused perspective. So we can't go into all of these chapters in very much detail now. But I'll just give a quick highlight of those 5 areas and the kind of issues that are covered within it. So meeting basic needs is really about having the foundations in place to live life and to live everyday life and thrive. So it covers things such as housing, having a good diet, having access to healthy foods, staying healthier for longer, and being able to access health and social care needs. But just to give an example, a bit more depth, the financial wellbeing section looks at some of the issues that particularly affect older adults. So some of the benefits that people might qualify for, some of the issues with things such as scams that might affect older adults. And it also then looks at what we're doing in Northumberland to address those issues. So, for example, we have a financial wellbeing network which brings together agencies across Northumberland to really think about how we can support all of the population, but also older adults in financial wellbeing. We also have Barclays Bank, who've started to set up in community venues, which make the service much more accessible for people in some communities that don't have access to a high street bank. And then we also have, it also highlights about the Northumberland Community Bank, which offers much smaller scale loans for people, so people don't have to get large loans and put themselves at risk of bigger debts, and supports people to save. So that's a bit of an idea of the kind of depth the report goes into on each one. And then being mobile, things like keeping physically active and maintaining strength and balance are really important for helping wellbeing. And obviously reducing the risk of certain conditions developing long-term conditions, but also falls, which can be particularly issues with people. So, and then access to transport and age-friendly places, really helping people to maintain connected, to keep connected and maintain independence in their lives. And then the next chapter goes on building and maintaining relationships, which I'm sure you'd agree is just such a fundamental part of life, being able to relate to different people around us. And it covers those issues of social participation, strengthening relationships, sexual health and intimate relationships, and also touched on domestic safety, domestic violence. And thinking about social participation, social isolation has been shown to be as harmful to people's health as some of the traditional public health issues such as smoking, obesity and physical inactivity. Really important issue that's highlighted there. Learning, growth and making decisions. This is really about helping people maintain control over their lives and be able to keep their minds active, which is really good for people's mental health going into life. And keeping people connected through things such as digital inclusion. And then the final chapter within the report looks at contributing to society. So this covers things such as employment, volunteering, caring responsibilities, and also tackling age discrimination stigma, which is quite a pervasive issue still in society. And thinking about the volunteering part, this really highlights the importance that volunteering can have both for the mental health and wellbeing of volunteering, as well as supporting people in the community through the volunteering activity. And it covers some of the things that are going on in Northumberland, such as Driving Together, who help link people up with volunteering opportunities across the county. And we're also looking to develop a volunteering passport. And this is something for the future, but it allows people, if they've been able to get set up with volunteering within one organisation, so they've gone through all the DBS checks and all those things, that they could then move into another organisation and volunteer again without having to go through all of that administration again. So there's some good things happening there. So the kind of things that we're really pleased about this report is that it gives this real positive strengths-based narrative on ageing compared with that negative lens that I talked about earlier, that focuses on deficits and disease. So that's a key thing. It also really acknowledges that there's significant variations in experience in older adults. You can't say there's one thing that describes ageing across the board. And it's strongly shaped by those advantages and disadvantages that we face through life. So older age is really where those things begin to show themselves. And then it's a really person-centered framework as well. So I think we've found these 5 functions of the ageing that the report's based around are really easy to relate to. So there's something, meeting our basic needs, being mobile, things that I think are very understandable to the general population. And we feel this is just a very kind of simple way to frame the report. So just going to some of the recommendations, obviously I won't spend too long, but as I've said, keeping promoting this strengths-based narrative on ageing well. Looking at ways we can embed ageing well into everything we do. So as I said earlier, it's not one programme or one organisation that's going to be able to support ageing well across society. It needs everybody to work together in a cohesive way. But we can look at ways that, even when we're developing new programmes, that we really consider the health and wellbeing of the older population in that process before we launch new things. We have a really strong and thriving ageing well network across Northumberland that's been going for many years, and it has around 200 people connected with it. So it's a network that we really feel has already had quite a good contribution, and we really want to see that continue and continue to grow. We drew quite a lot of data and information into this report. And as you read it through, you'll see there's quite a lot of different graphs and charts, but that almost sets the basis for continuing to monitor ageing well going forward. We're really keen to keep hearing the voice of older adults, and you'll see through the report we've got various quotes, and we really wanted to listen to what people were feeling in the community as we developed the report. But I think that sets a tone for something we'd really like to see going forward, is continuing to listen to voices, and that the voices of older adults help shape the way that communities and organisations respond. We've adopted an assets-based community development approach across the council and across some of our partner organisations. This is really about building on the strengths that communities have and harnessing them, rather than things being done to them by people from outside. And I think this is really relevant to the findings of this report, and something we really want to keep going with. There were 3 areas that stood out that we thought might require a bit more focus going forward. This issue that I mentioned at the end about ageism is lurking there in the background, and I think it's something that all organisations do. And thinking, how can we make sure ageism gets tackled across everything we do, and that we're not tolerant of that being there, and probably affects the most, well, probably one of the areas of discrimination that affects the most people. So it's something we really want to see addressed. I think strength and balance is something that we need to start integrating, doing things to build our strength and balance from little ages, really. So our muscle strength starts to decline really in our 40s and 50s, and then it keeps declining into older age. But if we start doing things in those middle ages, to continue to build our strength, we can maintain the balance in the older ages. And I think it's something that's not very well known in society. So I think that's something we want to raise the profile of. And then finally, social isolation is something we want to continue to combat, and particularly thinking about digital inclusion and improving transport connectivity, particularly as we're in a very rural county. So that brings me to the end of this presentation, and I hope that's been an interesting overview. Yeah, I'll hand back to our chair.
Right, well, there's an awful lot in here. And I don't think we all need to declare an interest if you're over 50. Personally, I'm okay. But there's a lot in here. Who wants to kick off? I've got one or two. Right, Councillor Hill, you.
Thank you. One thing I just wanted to pick up on is the issue of housing. Now, generally, and it is generally talking about housing problems and everything does affect younger people more attracted to the property market and so on. What I found, which is concerning with my casework, is an increase of older people looking for housing, which is particularly stressful when you have, just picking one example, a man well into his 60s, not in the best of health, is sleeping in his car. He's technically homeless. And you've got that shrugging the shoulders. Well, there's a shortage of housing, as we all know, and a perfect storm of things around the housing market, which make it very difficult. And he's not, this particular resident, and I've got other examples, but I'll just use this one to make my point, isn't in the priority area. So people think if somebody's homeless, you have to be housed. The council has to house you. That's not actually true. It's by law. There's a criteria that you have to be in, which I think is if you're a pregnant woman, if you've got under 16 or under, if you've got, which is a particular vulnerability, which there are case laws that house that defined. So I'm just wondering about how the housing allocation works, and are we doing enough? And I know it's tied in with national policy and indeed law, but are we doing enough in terms of the allocation policies to support and recognise the increased number of older people in a situation where they're either, in some cases, homeless but inadequately housed, which means they can't get up the stairs. You can't put a house, or they had somebody else the other day. They got very immobile and they far away from public transport links, shops, the family, and so on. So I'm just wondering what we're doing to help old people when they need housing needs.
We've got the gist. Do you want to go for it?
Yeah, and it's perfect timing actually. I'm definitely that within the Refresh Joint Health and Wellbeing Strategy, we've got a specific section around healthy neighbourhoods, and we are this year developing a new housing strategy. And what we've had assurances of, because we're working really closely, aren't you, Veronica, with housing, is that they will put health at the heart of the Refresh housing strategy. So they'll be looking at that through the life course. So this is timely for us to say, and this is the Ageing Well report for your consideration as well. So with the format that we've got on the tackling inequalities work, in April we're focusing in on voluntary sector, police and fire, but in October working with the Institute of Health Equity as well, we're hoping to major on housing and health as an area of particular interest for us in Northumberland because of the rural aspects, because of an ageing population, because we want to keep our young people. We've got so many specific dynamics, haven't we, that all come into having a safe, warm, affordable home. So there's an opportunity throughout this year to be able to play these concerns and opportunities into that. So I haven't got a specific answer for you today, but I think in relation to ageing and adaptations and houses for life and that kind of perspective, then our housing colleagues are cognizant of what we need to do. It's how we shape that within the finite resources that we've got.
Okay, Councillor Chicken.
Thank you. Two small points there. Based on it's looking at this chart here, it appears, to give me if I'm wrong here, it appears we have a much higher percentage of older people in Northumberland than any of the other, should we say, local authorities.
Yeah.
I believe we're the oldest age profile in the country.
Yeah.
So it's not just locally, it's nationally.
Is that a strong indicator that actually people in our area are living significantly longer than in other areas, which means that we are in fact doing something right? Because people are not dying as early as they are in other areas. Also an indicator that we have a reduction in birth rate, which is equally quite worrying. My second point was, just to give it some context, in my day-to-day job, I'm a sports therapist and I work in a gym. When we're tackling things like physical activity, balance, muscle strength, that sort of thing, are we looking at it from a male-female point of view? Because it's really, really important that we do. We have, what we say regularly is that we have cliff points at different stages compared to men versus women. A lot of those happen as you drop off into teen years, then when you get into the workplace, then when you have children. The physical effects of giving birth are so strong on females. Then you also have that bit in between where women tend to get themselves physically fit and active again because they're dealing with children, or they just have that little bit more time, they're settled in their careers. And then you get the perimenopausal, the menopausal, the postmenopausal, which has quite drastic consequences, but in a totally different way to the 50 bracket of men, where they seem to, I would say, get there relatively unscathed, and they hit the 50 mark and all of a sudden things go significantly wrong. And we see that time and time again in our gym. We see that time and time again in our gym, but we actually have some 70-odd-year-olds who are fitter than our 20-odd-year-olds, and it's remarkable. And the number one thing that we see there is attitude. It's their attitude. The facilities are exactly the same for everybody. The born, raised, went to school in exactly the same areas, but it's their attitude towards their physical health and their eating and so on. And that's bred into them from a very early age. And it's really encouraging to actually see the number of youngsters, 16-year-olds that we have in the gym who are choosing to come into a gym rather than be out on the street. But I wondered what we're doing specifically at those different levels for male versus female.
Yeah.
Yeah, you do.
Yeah, so with the first question about Northumberland's surrounding local authorities, I think both those things you mentioned probably do play into it. So life expectancy overall is higher in Northumberland than other areas, that people do live a bit longer. But I'd probably say the bigger contributor is the age structure. So we do have an older population structure. So like younger people tend to move away and some of the bigger cities, and then perhaps return back to Northumberland in the older ages. So it does have genuinely has an older age structure. I think both those things probably do key in. That makes sense. On the strength and balance stuff, I think this report, the way it's written is it tends to flag high level some of the issues, and it doesn't probably go into that level of detail that you've raised. But I do think that's something, like looking at the particular issues for parts of the population and barriers and facilitators for different groups, I think is a really important thing. I'm not familiar with that's actually happened yet, and probably something that Jill could.
Yeah, so you may or may not be familiar with the fact that we've been out for a large leisure re-procurement. We've used a new specification that's been based on our demographics of our local population and how we encourage more of our residents to be able to be physically active. Within the new specification, we're asking our new provider to be much more nuanced in their approach. So understanding that gender difference, for example, would come out, understanding age, understanding people who are furthest away from being able to be physically active. So as well as hopefully doing more within the leisure centres, we will absolutely be doing more outreach into communities as well to try and encourage participation and activity. But because I couldn't agree more with you around that difference between gender as well as age, and that functioning and decline is physiologically different, isn't it? So absolutely, good point, well made.
It's good to hear that.
Can I just comment? I used to do a lot of swimming. And ever since COVID, the booking system is just doesn't want you there. It's all we kind of just, oh, well, I've got an hour spare, I'll go for a swim. I'll tackle that somewhere else. But I think, you know, the legacy of COVID has meant systems are set up that make it awkward. You know, you've got to book online, you know, you get fast lane, medium lane, slow lane or whatever, and it's always booked. So I just some criticism. Anyway, but is it Councillor Hunter?
Thank you. Just thinking that it would be good if you could attend the Town and Parish Council Liaison Working Group. The next one should be in May. I'll find the exact date, because that way it will spread the word out to the parish councils. That's an online meeting. So.
Yeah.
Diet is a thing as well, because we age well, but it's diet, but the cost of living crisis that's hitting. People are looking for cheaper alternatives, which doesn't help either. And it's this integration with the younger ones, because yes, we could say ageism, but ageism comes with experience. And it's that experience that can teach the young ones life experience, but they can also teach the older ones how to do the digital. And I think it's how we can gel that together, because the younger generation can learn from the older ones, but it also keeps the older ones engaged and gives them something that they feel it's worthwhile, you know, and they're supporting that they've still got values. And I think that's how, you know, we need to, and I can see what you're trying to do in the report, and I think that's a way forward. But I think it's just always remembering there is still value there for them, even if it is aging.
Les.
Yeah, thank you, Chair. On the day I received this report, which is fantastic, I also got a phone call from my doctor to discuss my health check, as it were. And in the conversation, my doctor said to me, "Well done on getting to 69. I thought that was a strange remark, but I put a bit more pressure onto that statement. And he said that a lot of people don't actually get to your age because of various aspects of ill health and so on. And I've begun to appreciate, yes, I'm getting older. I'm getting to the point where I'm starting to get medical problems. And so I thank the doctor for his intervention. But that statement of, well done, you're getting to 69. Now, we all consider that, you know, 70 is 10 is like the benchmark. And we hear about people living into their 80s and 90s. And my parents are in their 80s and 90s as well. And I'm seeing the longevity of life. But I'm also seeing it being taken away as well. When I'm seeing it taken away is in my the older generation because of that poverty. I'm seeing issues within the community linked to antisocial behaviour and crime, and that's having an effect on various residents as well. I've also witnessed myself suicides in my community, which I think is tragic. And I'm thinking to myself, yes, I am blessed. I didn't think I would end up in Northumberland in my retirement years, but here I am. Because when I was in my 30s, I was working at Heathrow Airport, and my secretary said to me about Northumberland being a fantastic place to live and to come to and to enjoy holidays and so on. And I'm thinking back then in the 30s, you don't know half the truth because the level of poverty here is chronic. And that's why I was working in London. So.
Yeah, come on, what is it?
But the point I want to get at is the report is good, but is it really taking in all the disadvantages as well of living in Northumberland? The lack of connectivity with transport, the loneliness, the lack of connectivity within a community as well. Not all communities in Northumberland have a leisure centre or other fantastic facilities, or even in other parts of Northumberland libraries. And there's even a section on there about public toilets as well. Not all public toilets are open in the evening. Say, for example, there's a lot of things that could be improved within Northumberland. And so I like the report. It's a starting point. Are we starting to look at the nitty gritties, the individual things, like housing, connectivity, about the internet? We brought in, fantastic speed of internet, but the cost of it is just crippling, And have you considered how much a pensioner actually gets on their pension that's got to last a month? And the financial aspects, yes, you don't have private pensions and all the rest of it. You don't have pensions coming in from when you were at work and all these sort of things. Have you looked at the poverty level amongst pensioners? And then again, what about access to hospitals? Whether it's
asking a question.
Yes.
Are we having a rant? I'm not.
No.
I've given you a fair bit of time.
Yeah,
It's a fast thing you're covering.
Yes, Chair, it's all those things. I'm asking the question. How are you looking into the nitty gritties? That's what I'm asking.
Thank you.
Thank you, Chair.
Can I answer that, Chair?
Yes.
And just really, very simply, let's just say, we've got our inequalities plan. It's wide ranging across the whole council. The whole council is looking at not just older people, but inequalities across the whole council. Jill mentioned we do some work with housing, and that's a new one for public health to work together with housing. Let's look at healthy neighbourhoods. And so I won't go around there, but we do have this inequalities plan, which is wide ranging across the whole council. The answer is yes.
What we are aiming to do, and it's harder than you might think, is building where it exists, closing the gap indicators for us. So we don't only have top line at Northumberland level, this is the state of the nation. We are working right the way across the council to look at where the data is. Let's see what that difference is. Let's see what that divide is and how do we close that gap. And that's the work we're doing again with the Institute of Health Equity when they come online as well for that 20-year generational change, because you're absolutely right. There is huge diversity across Northumberland. The purpose of this report is to say if we get these functions in place, then the difference can reduce. So I absolutely hear what you're saying around that inequality and the starkness of some of that. And there are mechanisms that if we adhere to them, we'll be able to close those gaps.
Right. Thank you. I've got Colin and then Derry.
Being one of the people that's fallen off the far end of that scale, thank you very much, Les. I shouldn't be here. I'm considerably older than you. I try and keep myself fit and healthy. And in the way of a question, I'll say, will you agree with me? One, we have got a lot of richer elder people retiring into Northumberland because it is the place to come back to. And we offer them fantastic county, but also some fantastic services. I'm part of the Welsh Close Square Medical Group. I sit on the PPG and I'm also on the Lindisfarne Partnership. And we give out MOTs to people over 70. Les isn't there yet, obviously, he's not been called in for one, but I have. I've been to the doctors today. They're having a look at my medication. I didn't know that I had a problem. But they take me in and give me all the tests and then say, we'll give you that and off you go and you'll live a little bit longer. I'm quite happy with that. I don't like the alternative. The other thing that we have with our wonderful facilities is we have doctors' referrals. So people go along, regardless of the financial status, it is down on the state of health, they will be given free admission to gyms and leisure facilities. So it's not poverty-based thumb banging, it's what we are doing, what we are achieving, and what we look to achieve in the future. And I hope I'll get to see it. Would you agree with that?
Absolutely. I think we do have a good population that is thriving. It is affluent. People do retire here. What we're hoping to do is maximise that population to be able to contribute, give back, offer into community resourcing, whether that be through volunteering, the skills of retired people and what they can offer us for third career opportunities and such like. So I couldn't agree more in that respect. We do have a big diversity of population. What is the unfair and avoidable inequality is that when our people are hitting ill health by the age of 51, and there is something that we can do about that, when other areas it's in good health until 74. So that's the bit that we need to try and understand how we best narrow that by looking to have these things in place. But yeah, we've got a lot of strengths and assets, as you're describing, of which you are one.
And I hope to be here for a little bit longer, just keep an eye on you.
Right, Derry.
Thank you. Jill, thank you very much for the report. I think the Director of Public Health report is always a really useful resource for Health Watch, because I think it helps us identify the data behind a lot of what we work on, but also helps us understand what's being done to address some of those issues and helps us therefore focus where we need to focus. And I think in that respect, I was really pleased to see the chapter on carers. And I think seeing the very positive responses from the national survey was quite reassuring, and again the joint working with the Carers Partnership Board. However, I think the quote on page 60 for me highlights one of the really key issues, which I think goes through a lot of the other bits of the report and certainly through the recommendations, and that is the issue, the problems that arise where respite isn't available to people. And given the age profile of carers, it sort of then ends up being a double whammy, doesn't it? You have older people who are caring and they're becoming ill through caring. So it all starts to become like a wheel that just keeps turning. So I think we are, as Health Watch, we are starting to hear much more about people's need for respite, and I think that quote actually sums it up very, very clearly, and it's exactly what we're hearing. And I think that's why one of the things is that we're considering for next year is to have respite care as one of our priorities, and we feel that from those conversations we've had already that it's an area that needs more scrutiny. So I think again at some stage over the next 12 to 18 months we will be coming back with some work around that for yourself to think about. But I suppose my question around this also was that in the recommendations, I think the recommendation is very clear, very good, and I think it very all encompassing, and it's just making sure that carers are reflected explicitly within that.
I've just looked at Chris and we will feed that in. The respite and carers, I think, is a completely single subject.
Yes.
That we will look at. It'll get timetable. Before I come in, Colin, do you want to come in?
No, I was just going to jump on the bandwagon as I usually do and have my say on carers assessments. I think it's something that we need to look at, be it here or in the future. It is a major concern of all the charities that people are being left out there to get on with it, quite often not supported. We need to address that, and I'm sure we can.
Well, I think if we put it on the agenda, it will come. I mean, the picture that some people paint out there is different to what it is actually out there, because there's a lot of good work that is often criticised. It's made up in something else. But there's two things I want to actually try and get on the agenda. I mean, I know Councillor Sanderson has asked about volunteering being good for the older person to get in. It keeps them active, keeps them this and that. And I think we could actually delve into promotion of volunteering. And he would talk in the pre-meeting, we were talking about what you mentioned earlier about having a passport, that you didn't have to go through the rigmarole of the DB whatever checks and every check through every organisation. And I welcome that. And I think we need to look at that to make it easier to volunteer and be part. But again, there has to be the safeguarding checks and all of that. But I think, because I think elderly people are more vulnerable often than younger people, which brings me on to the other one, which is about on page 19 about banking and scams, because they don't target young people as much. Older people are targeted. We watched that program in the morning that I watched when I was getting changed this morning. And it was on about scams. I had one the other day, and it was from BT, and that my internet is being used illegally and all that. And press 1 or press 1 to speak to somebody. Do that. And of course, a foreign accent appears, and I'm not talking about foreigners, but a foreign accent. This is BT, and I bet you are. I probably get 2 or 3 offers of scams every day. I don't know if anybody else is the same. I'm not, like all of us around this table, we're not happy with the bank or the services that we get from the banks, because they've cleared out of Northumberland high streets virtually. And the older generation like to talk to a person, trying to ring them.
It's not just older people.
Well, you've got to set aside an hour just to get through to them, and even then, anyway. I think we would like, if we get the defibrillators off the dealt with. I want you to think about this. We put the banking, the scams, and volunteer into some sort of working group where we can actually have a look, because I'm fearful that anybody, I'm not saying the scammers read that, but if you were targeting the Northeast, you'd go, hang on, Northumberland's got all them out people. Let's have a go there. Any postcode or any telephone number that's in Northumberland, it'll be like a goal line rather than Newcastle, which is way down on the numbers. So I just think we need a further delve. Have a think about that. It will come through the processes, and we'll obviously, talk to people about it. But I think, go on, Les, is it positive?
Yeah, it's positive. I totally agree with you. I've had 2 streets in my ward where older generation actually live, and they've been targeted by scammers. In person, the scammers were physical people scamming them out of a situation. Some years ago, I had, which was tragic, really was, a woman who lived in a council property. She had a leak in the outhouse, and this kind person came along and scammed her out of a lot of money to support it, but it fell on the roof, which she could have got the council to do free of charge. But you're right. The older generation are not aware. They are from the generation from the 60s and 70s, where communities help each other. And they think that because somebody's willing to help you out to do a job, but they're not realizing they're going to empty your wallet at the same time.
Yeah, well, that'll come up. I've got 2 more speakers. Kath, don't you see more?
Yes, thank you, Chair. Yeah, thanks very much for this report, Veronica. Jill, this is, we do age well in Northumberland. I came here about 20 years ago to slow down, but, so many people come to Northumberland to retire, and they end up doing lots of volunteer work and really being active, because there's so much here. It's so beautiful. You want to get out there, go and look around the countryside. There's so much to do. So even though people think, oh, I'll go back to Northumberland and retire, they end up doing so much more, and which is really healthy. And I think, having grown up in London, we're so lucky to be here. So the other thing in this report, I see that, which is full of good stuff. I mean, I think really doing well. It says, although people say, there's a housing crisis, it says here there's 11,000 more homes since 2023 than in 2016. So we're still building lots of homes. So,
But we're not meeting demand.
well, it's.
You have the chance later, councillor Hill, in planning, where you can always vote for things.
No.
But if you live in, you know, for London, for instance, that it's a real crisis there. I mean, completely in other parts of the country. So although we're not meeting as much as we need, we're still building and we're moving up. So it's good news.
Right. Margaret.
No, it was just when you're on about scammers. We've got a forum on a Friday. We've got about 60 elderly people coming. And if any of them has been targeted on the phone by scammers, they come to on the Friday. So we've put it out to all the others. They're on that rounds again. They're phoning you up. Do not click any buttons. Just put the phone down.
You've just got yourself onto the committee. I think you know, like the defibrillators is interesting. This could be equally interesting. Whether we can do anything about it, I do not know. But as I say, the lack of a physical bank, and I know that there's bits in car parks and stuff, but it's not the same. Councillor Hardy.
Just a little mention on defibrillators. Northumberland Ambulance Service is now putting stickers on defibrillators saying out of service. One of which is at the church in Berwick, which you frequent. Nice blue sticker on it. Nobody maintains it, and we're still appealing for more defibrillators. We've got to get a grip on this, because somebody turned up to use it and found it was not maintained. Went to try and get a defibrillator somewhere else. Was involved in a road traffic accident, and by the time word got back to the rest of the family that were in the car park outside the church, paramedics had arrived. So it caused more problems than it solved.
Well, those that were there, we had a very, very good working group, and I'm looking forward to where we move to next with that. But the ambulance guy was spot on. Those that were there will know what I mean. It probably, I said this at full council, it was probably the most interesting meeting I've been to at County Hall. And there's been a few interesting ones. I mean, not non-interesting ones, but you know. Anyway, Les.
Yeah, you made a good point earlier about when you go to the shops or a bank or whatever, and you go and you speak with a person. Strangely enough, that conversation I had last week with an older person, and apparently they went to the shop to do their shopping. They said that they always go to the till, because guess what? That's the only person they get to speak with within that week. And there's a valid point. We got supermarkets, shops all over the place going to where you serve yourself, automated, and it's taken away the connectivity with another person. And that other person could be the person that you spoke to that week, and that's the only person you spoke to.
I know, and I think it was brought up, I think it was Penny Mordaunt MP brought it up, that supermarkets at Christmas bend over backwards to spend millions on advertising. And it does, do we any of us change our habits for Christmas to go, oh, must go to that shop or that shop? I don't think so. And they said, put more people on the tills.
Yeah. Yeah.
I hate those. Anyway, we getting on the tills, Margaret.
Yeah, when you're on about the defibrillators, you've got to make sure that, I mean, people are saying, oh, we want one, and they're getting them, but they're not registered, they're not keeping them up to date. If a person's going to get a defibrillator, they must be registered.
I think that's come through.
Get that through to them.
I think the next meeting that we have will be moving into that sort of area of what can we do. But as I say, that will come in time. You know, obviously I'm stacking stuff up to come into the group after that. So, right. Anybody else on this side of the room want to say anything about this report, because it's there in front of us? Good report. Yeah. Anybody over here want to speak on it?
What I will say, because I was reading it then, is despite having read the report, every time I look at it, I find something I haven't read, or I have read but haven't read in depth. So I just lost the meeting then because I got involved in what I was reading. So I'd just say, I think it's, I've said it already, but I say it again, it's really important. You've got everything you need to know. But it is the sort of where we are now, and I'm sure, you know, we will continue to move on all of this. And something one of my friends said to me the other day when we were discussing my leg, and she said, "It's no fun this getting old stuff, is it?" And I said, "No, it isn't." And then we decided between us it was probably better than the alternative, so we're sticking with it.
Councillor Hill, are you on about planning for houses yet or not?
It's not about housing. It was just, there's an interesting bit around sexual health.
That's what.
And I did sort of have images of somebody really old going into an STI clinic and thinking, but the serious point in terms of the statistics, just they sort of said about people from age 50 to 90 being sexually active. And I think that's quite a wide number, probably not good for statistic analysis to go from 50 to 90.
Because when we get the 70 fish and chips, I'm sorry, not fish and chips is better.
but that is not an accurate age to do that sort of data. I know it's a small part of the report, but when you look at it, you think you can't put people 50 to 90 in a.
You're nearly 50, aren't you?
And what we haven't got in Northumberland as yet, what we haven't got is a sexual health strategy. So the team are working on the development of that. We've got a very robust service where people can access STI treatment, long-acting reversible contraception, such like, but we haven't had the consultation and conversation about what is good sexual health within Northumberland. So that piece of work is on train at the minute, and we are seeking views and opinions. So.
But you agree you should be clubbing.
I think absolutely. It depends on what data is available, doesn't it? Yeah. Quite often. So
I think that came.
Are you looking for volunteers?
Yeah, that one came from a national survey. And
it's not our data.
They broke it down into very broad categories. So it's not local data.
And on that note,
yes. If I could just say, please do promote it, please use it as a resource, and obviously you said about attendance at the Town Parish Council liaison group. So if there are other forums, but please use that as a mechanism to showcase what we're doing and also to highlight what more we can do.
Yeah.
Right, thank you.
Can I just say that I think all members have got a hard copy of the report? Should have.
I don't know if there was enough copies with right.
This one's got Chris's name on it.
If anyone hasn't got one, collect one at the end. We're not far away. Right, thank you, the officers, on that one. Item 6, report of the scrutiny officer. Chris, forward plan.
Thanks, Chair. The forward plan of cabinet decisions, there isn't anything on there that cabinet will be taking that would normally come to this committee. The only decision that cabinet have taken that would fall within this committee's terms of reference is the extra care and supported living strategy from adult social care. If that's something members would like to come to this committee at some point, I will speak to the Director of Adult Social Care and we'll find the most appropriate time for that to come. That's the only thing on the cabinet forward plan. And then on the committee's work programme, at the next meeting, we were due to have NIAS come and present their quality accounts. But NIAS have asked if they can present their quality accounts to the regional joint scrutiny committee, which was set up to look at the ICB. So that committee covers everything from Durham all the way up to Northumberland. So from NIAS's point of view, it's presenting the quality accounts once rather than 4 or 5 times. Gateshead, who run the joint committee, have said they're happy for that to go ahead, as have a couple of other authorities. So if this committee's happy with it, what I propose is we will bring the minutes or some sort of summary of what NIAS have said.
And I'll take any questions that this committee have to the joint committee, which Councillor Dodd, Councillor Nesbitt and Councillor Essen-Sheldon attend. NIAS are also due to come and speak to us on the 2nd of April about ambulance performance at a slightly more local level. So if members do have any burning questions that they want to ask directly to NIAS about the quality accounts, there will be a chance still in April to do that. But it's just they'll not be here specifically to talk about their quality accounts. If that makes sense.
Councillor Hill.
I was going to say I wasn't happy about it until
I suggest
They are still going to.
but I mean, there are quite a lot of question things we need to scrutinise. And I was going to suggest the last bit that, you know, people don't have to come present reports. We can just read them and then ask questions when they come, because often that eats up time and things that we could actually just read. But and we have had this issue with them lumping the whole area in, you know, so we've only got data for that, which I found out, as you know, was nonsense. I did get the data for the Berwick area. So as long as, I think if you say any questions in the quality accounts, we've all read them, you know, don't they do it, and then the ambulance, which is the key thing, isn't it? So, yeah, I'm fine.
So if everyone's happy, then that will.
If anyone had a burning ambition to go to that meeting, then I'm sure we would take them along, because the public do turn up. They're generally a pressure group, but they do turn up. And it's really, really good.
So it's in Newcastle.
It's in
Gateshead.
Yeah. So, yeah.
But if anybody was desperate to go, we speak and we all turn up and go there. So if they wanted to go, we make sure you got there.
Because it's the ICB focus, they cover a lot of things. So I think on the agenda next week as well is pharmacy. We've had some dental updates as well, because they talk about the ICB as a whole rather than just specific areas. So it is quite good, and it's possibly something we need to look at how that committee reports back to this committee as well.
Are we allowed substitutes on that?
We have an appointed substitute, which is Councillor Flocks.
Yeah, I'd just say if there was a way that we could get feedback from their meetings, it would be actually handy.
How would members feel about just copies of the minutes, a bit like we do with Health and Wellbeing Board? Or would
Yeah,
That's yeah.
See if you could highlight something and we could give it some air and see if we need to take it somewhere else.
Yeah. Thank you, Chair.
Okay. Right. Urgent business, I have none. Date of next meeting is the 2nd of April at 1 p.m. So, thank you for your attendance.